Welcome to Kids Matter. I'm Dr. Elisa Minkin. As a pediatrician, mom, and grandma, I understand how challenging it can be to help our kids grow into their best selves. We are so much more powerful together. Here, I will be sharing the knowledge and wisdom of a wide range of people who understand and care deeply about children. I'm hoping for your input as well, because kids really do matter. They are our future. Welcome back. Today I'm here with Dr. Rachel Fryman. Hi. How are you?
Good to see you again.
Dr. Rachel Fryman specializes in supporting adults navigating daily life and transitions with a trauma-informed and neurodivergence-affirming approach. Together with clients, she explores the impact of the past and distracted living on relationships, academic achievement, job performance, and overall well-being. Rachel works collaboratively in sessions to identify and incorporate strategies to manage challenges so that every day is less stressful and more meaningful. She's an assistant professor at Yeshiva University Wurzweiler School of Social Work. She consults, lectures, and researches on the intersection of Judaism and mental health. So I'm really excited. This is not my first rodeo with you. I'm excited to have my second interview with you. And my first one was for a podcast through the Jewish Orthodox Women's Medical Association, or JOMA. And I'm going to link to that episode too, because I feel like this takes off where that one left off. And you've moved up in your age group that you work with. And we're going to talk about that age group. But I still want to keep it from the lens of the parents' mindset as well.
Mm-hmm.
Because
and my work has only evolved.
Exactly.
Still working with young adults and parents a lot around parenting and co-parenting and neurodivergent parenting for neurodivergent parents as well. So it's been a few years, but it's so exciting to be able to have these conversations again.
Absolutely. And that was what I was hoping you were doing, was working with neurodivergent parents, because that's a really important niche that I think is underserved. So I'm really, really excited to talk to you about all of these things today. So let's start with just actually a definition of what we mean when we say neurodivergent or neurodivergence.
So neurodiversity is a sociological term that came about by Judy Singer a while back and has been adopted, I think, by the mental health community and really advocates in the mental health community saying, I don't need a diagnosis. I don't need to be ADHD. I don't need to be autistic. I don't need to be a learning disability. I don't need to be defined by my anxiety, my depression, my diagnosis. I want to embrace the fact that I think differently. I operate differently, and neurodivergence and neurodiversity as the umbrella term includes all different abilities. And as a sociological term that I think that has been adopted by the mental health community, it's empowering. It takes away the labels. If someone doesn't fit exactly with the definition, is it ADHD? Is it autism? Is it a bit of both? Especially for the women that I work with who might not meet diagnostic criteria for one or the other or combined. So having a rule out of something, it can be very affirming to be able to say, I'm neurodivergent. I have clients that come to me saying, I'm neurodivergent spicy. I have a bit of an ism. I think outside the box.
Right.
And it can be very affirming to be able to belong to this community of people who think differently, who are not limiting themselves to DSM, Diagnostic Statistical Manual diagnoses, but are self-identifying as differently abled.
I love that. And I love that it's not a pathologizing lens, and you don't need a diagnosis. Like you said, not everybody fits into the box. The whole concept is we don't need to fit into a box, right?
Right. And for women, and maybe this is an important conversation to have. So for so long, women were not being appropriately diagnosed.
Right.
The DSM more or less was geared towards diagnosing boys and men for ADHD and autism. And the criteria that was included in the DSM was more geared towards male gender. And that meant that the research agenda was more geared towards male gender. And then the clinical interventions were more for male gender. So women, girls have been excluded from the diagnosis, from the research agenda, and from the clinical interventions. And there's been a ton of work over the last decade and a half or so to close the gender gap, something that I'm really interested in and have been following. Just this year, I read a new book that came out on autism from the UK, and bridging that gap, closing that gap on diagnosis of women with autism by a neuroscientist who literally is studying that the women's brains are different. And I think when we're having these conversations about gender and neurodivergence, it's really important to identify that women might not meet all the criteria for ADHD. I'm interested in emotional dysregulation for ADHD, which is actually not one of the diagnostic statistical manual's criteria for
Right.
ADHD, which is so interesting. The European consensus that came out in 2019 does include emotional dysregulation, and that is really, really affirming for women who are neurodivergent, who identify with the emotional dysregulation of ADHD, even though it's not in the DSM. For autism, the research agenda has also been more gendered towards male presentation. Women are really good at masking, at covering up. In the neurodivergent community, I've heard about camouflaging as well, like blending in. And the cost of that is that burnout. It's the depression, it's the anxiety, if it's the self-harming, it's the exhaustion, it's the perfectionistic, tendencies that come along with trying to fit in. So when we're talking about neurodivergence, we're creating a language for people who might be ADHD, might have a bit of both. And now that we have the DSM-5, you can be diagnosed with ADHD and with autism, but you might not meet full criteria for either. And then the neurodivergent label can be really, really empowering.
Right. Just so to be clear, ADHD is not a DSM
Nope.
diagnosis. It's a term that's taken over in social media,
Yep.
which has its pluses and minuses, to be fair. But the ability to be seen and to be able to find what your challenges are and your strengths and find your community is a very powerful thing.
Right.
And I like
Right.
that you don't have to have a diagnosis to understand yourself or to get help and to even understand that the diagnosis might have left you out.
Yeah, and that you might be masking, you might be camouflaging, you might actually meet diagnostic criteria, but the diagnostic criteria at that moment is not necessarily evaluating how you truly present. And I've heard that from women who, they're able to mask, they might not meet full diagnostic criteria, and then at certain points in their life are able to look back and be like, no, when I was a kid, I was that kid. For ADHD and for autism, it can't come out of nowhere. So one of the things that I'll do with clients is really do a thorough evaluation with them of like, when did these struggles begin? And that's like kind of a developmental biopsychosocial spiritual assessment that starts way back when. And if someone is struggling with attention, with organization, with time management, with emotional regulation, and it's happening all of a sudden, well, then it's not necessarily neurodiversity that we're neurodivergence that we're
Urgence.
looking at. We're
Right.
looking at, and in this situation, is there anxiety, is there depression, is there a trauma that's happened, is there a underlying medical condition, and then those are criteria that we're looking at. And it's really important in those situations to work with a physician, because if there is an underlying medical issue that's caused this change, you want to make sure that they're being taken care of. So for ADHD from childhood, I think part of the work for adult diagnoses, which are the population I'm more or less working with now, is being able to think back, like how their life could have been different, would have been different, and how to process that new diagnosis as an adult, and then plan appropriately, figure out the supports that they need to be able to thrive as an adult with neurodivergence.
That's terrific. But I want to dig a little bit into who needs a diagnosis, what the value of a diagnosis is, because I
Yeah.
think you can meet criteria for a diagnosis and choose not to get it,
Yeah.
right? You can still get help, especially when you're older and you're not necessarily getting help through the label. When you're younger, you're a
Right.
kid, you need to get whatever label you need to get the
Right.
services you need. But when you're an
Right.
adult, it's not the same calculus, number one,
Sure.
right? You may not want to identify as a specific diagnosis. You may not even
Right.
want neurodivergent, but that's a separate conversation. But at times it can really, really be important at any
Right.
age. So I want to hear your thoughts on that, please.
Right. So for many years, I've been speaking to families about the importance of a thorough neuropsychological evaluation because ADHD has so many comorbidities. We know that increased learning disabilities, so whether it's dyslexia or dysgraphia, so difficulties with reading or with numbers, auditory processing disorders, all have higher comorbidities with ADHD. So if there is a known diagnosis of ADHD, one of the things that I've worked with families over the years has been the importance of a thorough neuropsychological evaluation that might also, screen for anxiety and depression, and maybe, if there's concerns, including, an evaluation for autism. It really depends on what the neuropsychologist decides. And then that information is used to make treatment recommendations. It's used to make testing and school accommodations, and becomes a living, breathing document that can be a tool for the family to use in school and support them with either 504, which is a medical accommodation plan, so extra time or classroom accommodations, or an IEP plan, an individualized education plan, which will then possibly offer, if they qualify, resource room, OT, PT, speech, vision, assistive technology, so services in school, as well as the testing accommodations and classroom accommodations that would be recommended by the neuropsychologist in collaboration with the family and maybe with the physician, the therapist, and the teachers.
Right. So when you're talking about a 504 or an IEP, you're talking about kids in the school system until graduating from high school.
Right.
I was actually, first of all, there's an intermediate period where you go to college and grad school
Right.
where that system doesn't apply. And I do want to let you talk about that.
It's actually in New York State, for example, there are services like Access VR, which will extend through college. And in many colleges, you bring your declassified IEP or 504. So at the end of high school, you're given a document if you had services or accommodations in high school. And the responsibility is for the college student and their family to then bring it to the college Office of Disabilities or Office of Accommodations. Every school kind of has their own services, and then work with the college to make the accommodations. So this isn't a given. It's the onus is on the family to bring the neuropsychological, to bring the declassified IEP or 504, and then see what they qualify for in terms of testing and classroom accommodations at the college level. Similarly, there are accommodations for graduate school application tests. So if someone is planning to use their accommodations on graduate school admissions tests, to really make sure that they have a track, like a record of that they are using their accommodations, they've updated their testing, they've updated their doctor's notes, so that, if they choose to apply to graduate school with accommodations or need accommodations for graduate school admission tests, whatever the discipline. So if it's for business school or medical school or law school, that there is a record that they've been using accommodations consistently.
That's a good explanation. Just for clarity, this is under the American Disability Act or ADA.
Yes, so the ADA Act does protect much of this. I have worked with clients in the past who have even studied for licensing tests. So after graduation, they've applied for accommodations for licensing tests. Each state might have to review the documents and then decide on a state-by-state basis what accommodations they want to give based on the available documentation. So this documentation record kind of starts in elementary school or high school or whenever accommodations are being given or when testing is being done, but it can extend through college and into the workplace as part of the ADA Act.
Correct. I'm going to just put a plug in for early diagnosis
Yeah.
here because
Yeah,
as a
go for it.
pediatrician, I've seen the situation where they're graduating high school and all of a sudden they want to get diagnosed as something, or they want to get accommodations on testing. And it's actually harder to do
Sure.
that at that
Yeah.
point.
Yeah.
But even just from a pragmatic standpoint of, it's always better to know what you're dealing with earlier.
Right. And the research indicates that early intervention, like there's been a bunch of studies on boys with ADHD, and that when properly medicated, so diagnosed, medicated, treated, so the multimodal approach of medication and therapy and early and intervention by adolescents, those boys mitigate a lot of the risks that come along with undiagnosed ADHD, such as substance abuse, harmful behaviors, antisocial behaviors. So, we might be concerned about the labels, but the research, at least preliminary research of these boys into adulthood, does indicate that early intervention, meaning medication management, appropriate treatments, that those boys are actually thriving.
I'm glad that you mentioned labels, because there is definitely a concern of stigma, but there
Yeah.
is a real issue with labels as well. It's
Yeah.
not, it's a double-edged sword, right? And so if you think of these issues as being on a spectrum, right? It's not that you're either normal or not. We just talked about calling yourself neurodivergent as a variety of normal, right? Like we're
Yeah.
expanding. We have a paradox here, right?
Sure.
We're trying to get help. When is it a disorder? And when is it just a variation of normal, right? Because
Right.
you would think you would need a diagnosis if you had a disorder, but not if you're just quirky.
Right. So I think the quirky can be embraced, but if someone is really struggling, the label can also be really affirming.
Mhm.
There's a classic ADHD book that I always go back to. You Mean I'm Not Crazy, Lazy, or Stupid?
Mm.
Great book title, an older book, but the terms, I think, of being diagnosed and then knowing that there's not something wrong with you, that you just think differently, in my experience, has been really, really empowering, because something's wrong deep down. If you have a terrible time with time management, if you're always losing things, if you're forgetting to call back friends, if you have a hard time with your emotional regulation, if you can't fall asleep or you can't wake up in the morning and you're really, really struggling with routine, doing your homework, getting assignments in, you're different. You're different than your friends, but you might not know why until there's a diagnosis. So often, especially the girls that I work with might have had a social anxiety diagnosis, a depression diagnosis, an anxiety diagnosis, panic disorder diagnosis. They're getting diagnoses because they're struggling.
Right.
But the underlying issue might be, and often can be, ADHD that isn't being managed. And when the ADHD is addressed, the anxiety, the depression, the other symptoms, I don't want to say dissipate overnight. There are comorbidities, they can coexist, but often it is really, really empowering for clients to know that they are neurodivergent, that they think differently, and that with the appropriate treatment. So I always think the gold standard is multimodal approach, even though medication in ADHD is often, what's tried first, that with the medication and with whether it's executive functioning support, tutoring, OT, speech, coaching, whatever the other services are to support the neurodivergent thinking, that the symptoms do alleviate. There might be times where the medication has to be adjusted, or the services have to be changed, or you have to go back for therapy or whatnot. But just having the diagnosis, that you can, ADHD is highly treatable, but untreated, it's also highly destructive. And that's something that, especially when I'm working with adults, they've found in their own lives.
Exactly. And what I'm thinking about is, okay, it's a spectrum, but the bottom line is function, right? The bottom line is intensity, duration, frequency of the issues. That it's not a black and white thing. It's not like in every setting you either have a functional issue or you don't. And that at different points in your life, you may be pushed from just being a little different, a little quirky, to having a functional problem. And that's where you come in. And I want to hear more about what you do, Especially because I think one of the challenges, once you leave high school, once you turn
Yeah.
18, the ball's in that young adult's court
Right.
primarily.
Primarily. And I think that's where it's really, really important to think about the neurobiology of the adolescent brain. Adolescents are not fully developed until the adolescent brain is not fully developed until 25, even though legally at 18, your kiddo is independent. And I would even argue that it takes longer with ADHD. My grandma always used to talk about like a young 21, someone's
Right.
a young 22, a young 23. They might appear more immature than their friends, and that's okay. The same way that developmentally a neurodivergent kiddo, takes longer to adjust to middle school and then longer to adjust to high school. Well, it might take longer for them to adjust to college also. Do they need a gap year? Do they need a year off to work, to travel, to think about what they want to be when they grow up and where they want to go when they grow up? Do they need some more time to learn life skills? So although, an adolescent 18-year-old is officially a grown-up when they're going to college, they still often do need family support. And that's, I think, something that really does come up for those of us working with neurodivergent college students, that the family support is really, really important to help that transition to college. And that the scaffolding, the different levels of support really have to depend on each individual case. I always say when you've met one person with ADHD, you've met one person with ADHD. We're talking about there's inattentive type, there's hyperactive type, there's combined type, there's different severities of it, as you pointed out. So depending on how the ADHD is managed by medication, by therapy, by severity, can really determine how much parental support is necessary. And going forward, how that young adult manages transitions really does depend on their support system and the support system that they build for themselves after, having their parents maybe advocating for them.
That's great. First of all, you took that line from Dr. Stephen Shore, who's a fellow Long Islander, who said, if you've met one
That's
person on the
autism.
autism spectrum, you've met one person on the autism spectrum, and that's part of the neurodivergent family.
I am inviting him for, is that where, and I
Yeah.
think he might have also taken it. Yes, he's actually an old colleague from Adelphi.
Amazing. He's
And
awesome.
he's amazing.
I
And
interviewed him for
I'm
Joma
having
too.
him
Maybe
as a
now I
guest
have to link to
lecturer.
that as well.
Please do. Please do. Yes. So, and with ADHD, it's the same, the diversity within the diagnosis. And that doesn't even include the emotional dysregulation piece that isn't even accounted for in the DSM. So, when we're talking about transitions, those tend to be the times that adults really do need a lot of support. Graduating college, beginning or ending relationships, beginning a new job, looking for a new job, managing at a new job, moving, new roommates, new living circumstances, starting a relationship, ending a relationship, becoming parents for the first time, becoming parents for the second time or third time, difficulty with work, difficulty in relationships, something that when I turned 40, I decided I was going to start supporting couples, neurodivergent couples. So I did the trainings on with EFT and Gottman. I'm in the middle of Gottman trainings now to really support couples who are married or in committed relationships and are having transitions within their relationships and how to support them as a couple, whether it's one neurodivergent partner or both, because those transitions tend to be tremendous stressors. Transitions are hard for everyone. They're even harder for neurodivergent individuals who struggle with either the rigidity of this is how I do things and this is how I'm comfortable doing things, or the difficulty of maintaining routine and structure, especially as changes are going on.
Absolutely. That's amazing. I will underscore what you said about the developing brain. I don't think any 18-year-old today is truly an adult, no matter how neurotypical they are. But if you're neurodivergent, I've heard like a calculus of something like 2/3 to even 50% of their chronological age. So
Wow.
a 20-year-old could be like a 10-year-old if it's severe enough. And I've seen that
Right.
as
Yeah.
a pediatrician, and I really want to implant that in parents' minds in terms of managing expectations. But here's the tricky part, and I really want to hear your thoughts on that. How do you balance scaffolding support as a parent and not enabling and overdoing it?
Yeah.
That's a hard one.
The hard one. And when I'm working with parents, when I'm working with families, and the adolescent, the young adult is the identified client, something that I ask the parents before we start working together is, how involved do you want to be? What's your comfort level? You know your child best and you know your needs best. And to really support the parents as well in identifying what works for them. You know, a lot of parents get to be empty nesters when their kids go to college or enter the workforce. The parents that I'm working with are acknowledging that they are supporting their kiddos for longer, that their kids might move home at different times, and that support system looks different. So, you know, how do we address the scaffolding? It's really on a case by case basis, depending on the needs of each individual family. And I think that's an important conversation for parents to have with each other, for parents to have with their children, and to really identify what they're able and willing to do into adulthood.
That's a really good answer, and it's very fair. Bottom line is it depends, but I'm
Yeah.
going to push back here. And
Sure.
the reason I'm pushing back is because what I see as a pediatrician is that it's very common for the parents to have trouble tolerating their child's discomfort. The only way you can
Yeah.
grow,
Yeah.
right, is by pushing through discomfort. And
Mhm.
how do you help the parent back off appropriately when they're overdoing it? Because they may say, this is my comfort zone, but that may not be the healthy
Sure.
zone for that child, young adult.
Right. Right. And right. And how do you parent an adult child? Right. And I think that's a question for all parents, and especially for parents with neurodivergent children who have been so involved in advocating for their kiddos. And that transition is definitely a challenging one. So you mentioned, you didn't say it, but you were implying that this concept of grit, of resilience,
Mhm.
of supporting young adults with launching, right? And I think that if we're looking at the literature, we need to be especially mindful of setting our kids up to succeed by giving them therapy, by giving them tools, and doing that, you know, when it's developmentally appropriate. So something parents can do is offer to support their kids with a job coach, with a relationship coach, with social skills. And again, this is the expense of having a neurodivergent child. It is costly. I would argue that a job coach can help save money in the long run if someone can keep employment. A relationship coach can be helpful to support developing healthy friendships, healthy relationships. We know people who are in meaningful attached relationships are happier, they're healthier, they live longer. So if we're looking at, you know, how to support adult children, something to do is to continue to, whether it's financially or emotionally, help them be linked with services that they need while they're figuring things out. So that scaffolding can be with empowering them. Is it going to your psychiatrist? Are you financially helping them? Are you helping them with resources to identify appropriate providers in their college town or where they move as young adults? Are you supporting them with, you know, cleaning help from time to time? I always say cleaning help is cheaper than a divorce to my couples, even if it's an upfront expense. So really thinking about the financial commitment as well as the emotional commitment that you want to make as parents of adult children.
That's a great explanation. I just want to push back on one thing and go back a little
Sure.
bit to the neuropsych and to acknowledge that not everybody has the money to pay
Yeah.
for any of these
Yep.
things, even as the neuropsych can have a true value, especially if you get a later diagnosis.
Yep.
If your kid is younger, you can get it through the school system. It's not exactly the same thing, but once you're older,
Right.
you may need to. Just a thought.
So yeah, this is something I struggle with
Right.
as a clinician. You know, for many years, I did accept insurance. I recently stopped accepting insurance just because, you know, I have an academic position as well, and
Right.
the time that I do give to clinical work is limited. But there are really great coaches. There
Mhm.
are really great clinics. I trained at a clinic that took insurance, and even supporting your kiddo with health insurance, giving them the tools to find a provider in network. finding apps that support their executive functioning, that support their routine. There are some really great, affordable apps that have replaced a lot of coaching. I don't want to say therapy, but there
Right.
are coaching, executive functioning apps, mindfulness apps that are much more affordable and can either supplement in-person their psychotherapy, especially while someone's doing well, and to acknowledge that there might be times of transition where they need to be seen in person, but that there are many, many services and many, many supports. CHADD is an amazing resource, CHADD, Attitude Magazine. There are support groups, there are meetups, but to find a community does not necessarily have to cost money that's in addition to the health insurance expenses, which are also, if someone's unemployed and struggling, there are, it is definitely difficult. So just talking about intersectionality and thinking about privilege and vulnerability is definitely a consideration.
Right. And also build your village. I feel like we've become such a transactional society, and getting people in your circle who can help, not for money, right? Just building relationships so that the burden is not just on the parents. It's really, really hard to be a parent in general. It's really hard to parent for twice the amount of time, because that's how long it took your kid to get mature enough to be self-sustaining, if
Yep.
ever.
Yep.
So
Yeah, and there are services. There is Access VR, for example, in New York State, that lasts through college. There are coaching services and like job placement services that might not specialize in supporting neurodivergent, but do specialize in supporting young adults, and really finding those services, working with your young adult to identify what they need and how to best find that support can be really empowering as a model of how they're going to go forward into their adulthood, figuring out what they need.
right, and support groups, right? I mean, I believe that there are various support groups, either in person or online, for the a young adult neurodivergent person, but also for the parent who has to navigate something really tricky, right?
Yeah, there are definitely community groups, different CHADD chapters. CHADD have different offerings. At the International ADHD Conference last year, I had the privilege of meeting different chapter presidents and hearing about all the amazing work that individual chapters are doing. So really the wonderful thing about the neurodivergent community is that they're extremely welcoming and really supportive. And whether it's online or through local chapters, there are great resources out there.
That's true. And this is a great place to end. And so thank you so, so much for doing this with me. I really appreciate it.
Thank you, Alyssa.
You got it.
Thank you for listening to Kids Matter. Raising healthy, happy children takes a village, and I'm grateful you're part of ours. If today's conversation resonated with you, please share this episode with another parent, grandparent, teacher, or anyone who cares about kids. Together, we can build the supportive community our children deserve. I'd love to hear from you. Share your thoughts, questions, or suggestions for future topics at kidsmatterpodcast@gmail.com with no exclamation point. Your voice truly matters. Until next time, keep advocating for the children in your life, because kids really do matter. They are our future. I'm Dr. Elisa Minkin, and this has been Kids Matter. Please note that while I am a pediatrician, I am not your child's pediatrician. This podcast is for informational purposes only and does not constitute medical advice. For any medical concerns or decisions, please reach out to your child's healthcare professional.